right, well, thank you very much, everyone, for joining us for this webinar on BC Transit Mobility Justice and the Challenge of Population Aging. My name's Laura Kadawaki, and I'm a Research and Knowledge Mobilization Specialist with United Way BC. So I'm happy to help just introduce the webinar topic and then turn it over to my colleagues. And so to start off the webinar, I'd like to do a land acknowledgement. So United Way acknowledges the homelands of the Indigenous peoples of this place we now call Canada and honor the many territorial keepers of the lands on which we work. I personally today am working from the traditional, ancestral, and unceded territories of the Coquitlam First Nation. And so would like to acknowledge my position as a settler and appreciate their stewardship of these lands. I think the topic that we're talking about today around mobility justice and transportation is obviously a very important one for many Indigenous communities across Canada. And so I just did want to highlight the fact that in the inquiry into the missing and murdered Indigenous women and girls, one of the calls for justice actually focuses around the need for more access to transportation. So this is obviously a very important topic for all communities, including many Indigenous ones. And there is a really interesting report that's actually been put out about mobility justice and how to improve that for First Nations people in Canada that was published in 2024. So I just recently looked into that for this webinar and read it, and it was very interesting. So I'll share it in the chat in a few moments in case other people are interested in learning about this topic from Indigenous perspectives. Before we begin the webinar, I did just want to make some brief housekeeping notes. So during the webinar, you'll be muted, but feel free to introduce yourself in the chat if you'd like. You could put in your name, pronouns, organization, the territories you're calling in from, whatever you feel comfortable. If you would like to have a closed captioning feature, you can look at the bottom of your Zoom toolbar, and there's a CC feature that you can click to turn on the closed captioning. During the webinar, there will be a brief question period at the end. But feel free to put in questions throughout the presentation in the chat box or in the Q&A box. And finally, the webinar is going to be recorded, so you will be able to view the recording at the end, and the slides will also be made available. And so then without further ado, I'm going to hand this over to my colleague, Dr. Beverly Pittman, who's going to be introducing the topic and the presenters.
Thank you, Laura, and good morning, everyone. Welcome to you all, including our guests from BC Transit. I'm here as a healthy aging manager with United Way BC, responsible for the Vancouver Coastal region. And I'm also here as the staff support for a provincial working group on seniors transportation that we host. In fact, this series of webinars, and this is the first of 3, we hope, is a continuation of some work that the Provincial Working Group on Seniors Transportation and United Way Healthy Aging has done in the past in connection with the Summit on Aging. The Summit on Aging was held last November, and the title of that workshop was Advancing Seniors Transportation in Small Town, Rural and Remote British Columbia. It had a huge turnout. We had a shorter than required Q&A period. Quite obviously, the interest was real, and we felt it. And so the Provincial Working Group decided to continue on with this focus on advances in seniors transportation in BC as it relates to these underserved areas. Some call them transportation deserts, in the form of webinars. And first up, we have a webinar presentation by 3 people, representatives of BC Transit. I'll be introducing them to you shortly, and they'll be presenting, and we will be following their presentation with a Q&A. I understand that their presentation is 20 to 25 minutes long, and so that should give us 15, even 20 minutes for questions. So back just briefly as to why this is important. Why are we continuing on with part 2? It's because of population aging in British Columbia and the fact that we have a transportation system in place, both for private vehicles, the road system, and public transit that was not built or designed at a time of the large number of older adults who were no longer driving. And we're just, of course, going to see more and more of this as people age and drop the driver's license for one reason or another. So there's a number of questions that the group of panelists have seen already. But to give you a sense of the kind of territory we scoped out for them before they stepped in and said yes and made us happy, we asked, what does accessible transit look like in BC today? And in particular, what does it look like in small town and rural remote areas of the province? Are there any new services that accessible transit users can look forward to? And if so, what do they look like? Where will they be? Last, is BC Transit planning to expand HandyDART services? And again, if so, what communities will be served? So that's the general territory we're embarking into. And as I say, we have 3 people from BC Transit who have been good enough to spend an hour with us on this important topic. And I'll introduce you, first of all, to Bart Wallman. Good morning, Bart. Welcome. Bart is BC Transit's Government Relations Manager for the Okanagan region in particular. He has a decade of experience in the public transportation sector and 15 years experience in intergovernmental relations. Recently, at the BC Transit annual workshop, Bart and colleagues delivered a presentation on seniors and public transit. So the timing is good. We've struck while the iron is hot, Bart. And that was a presentation on seniors and public transit to the local government representatives and other stakeholders. Next up is Adam. Adam Bishop is the manager of Accessible Transit at BC Transit. With his extensive background in competitive wheelchair basketball, radio journalism, and human resources, Adam brings both lived experience and professional insight to his work. Adam's passion for accessibility and problem solving makes him a driving force behind improving accessible services at BC Transit. And I understand that that was written by his colleague, Afzal, and Afzal is next. Afzal is the Accessible Transit Coordinator at BC Transit. And in his position, he recommends policies and ensures a quality assurance. With a background in policy and advocacy work, Afzal helps ensure HandyDART service delivery is equitable, consistent, and fair. And I should add too that Afzal is serving as a member of the Provincial Working Group on Seniors Transportation as a member, and his presence is appreciated there. So this is the point where I turn it over to the folks at BC Transit and you, although I do not know who's up first. So over to the 3 of you.
Bart gets the pleasure of kicking us off. So over to you, Bart.
Okay.
Thanks, Adam. So my name is Bart Wallman. I'm BC Transit's Manager of Government Relations for the Okanagan region. So my territory is up as high as Salmon Arm, down through Vernon, Coldstream, the North Okanagan. I've got all of Kelowna, as well as the South Okanagan, Similkameen, as far as Princeton, down through Oliver and Osoyoos. So I saw lots of names kind of firing through the chat there. So hopefully I've had the good good fortune of bumping into a few of you. I believe I saw Desert Sun kind of cruise through there, and I know that you guys are really involved in the community, and we've had a few good discussions with the organization. So kind of a side benefit that I didn't really appreciate to showing up here was the ability to maybe make a connection, not just today, but after this presentation as well. So if you are Okanagan kind of based, feel free to reach out to me anytime after our presentation. I think with that, Afzal is going to put up the presentation. I'm going to speak to kind of BC Transit, who we are corporately, what we try to accomplish, and how we do it before passing it on to my colleagues to get more into the I was going to say into the weeds, but more into the details of what our projections are for BC's aging population and how BC Transit feels we can best serve seniors kind of going forward. So next slide, please. Oops. Great. So as I mentioned, we're going to do a brief introduction. I'm going to be walking us through the background, and then I'll be passing it off to my colleagues to get to kind of the real meat of the story. Next slide, please. So who is BC Transit? I noticed also in the chat that there were quite a few folks from Metro Vancouver. So I think an important distinction when we talk about who BC Transit is also who we're not. So BC Transit is a provincial crown corporation. We are governed by a board appointed by the Minister of Transportation and Transit. So that ministry recently was rebranded to really kind of show the emphasis that the province has on transit as a really important transportation mode within the province. But we are responsible for planning, funding, and operating over, I think, 130 different kind of transit systems in 60 different communities throughout the province. We operate everywhere outside of Metro Vancouver, and we operate with a really interesting model that's unique within Canada. So the province, BC Transit, and local governments all partner together to ensure that transit is affordable, operationally feasible, and put together in a way that really makes sense for a wide range of communities. I noticed today that we're going to talk about rural transit. There may be a focus on that, and I think that's really timely. So the way that BC Transit's model works is it really allows us to have more impact across a wider variety of communities than you would see kind of anywhere else in Canada. So we're really proud to have transit service operating in all communities in BC, I think over 10,000 people, which is quite unique. And the strength of that is based on our kind of shared service operating model, which I'm going to talk about over the next couple of slides. But that kind of market penetration outside of Metro Vancouver is really great. We've got 58 million passenger rides last year. We're seeing about a 10% year-over-year increase in our ridership, which is fantastic. We've come out of COVID where ridership dropped about 60% to kind of a baseline of 40%. And then we've really quickly been able to recover from that. I mean, I know that talking about kind of quick recovery from COVID, it seems like it's been a long time, but to watch, riders come back and change their habits and adapt to, working from home and a whole bunch of other kind of new changes, and to watch transit continue to be as much, if not more, of people's lives post-COVID than pre has been something that's really encouraging to us. And, to that point, we serve about 1.5 million British Columbians. So that's not ridership, that's the population that's within our transit service areas. We're in 130 communities. We have 81 transit systems. So we've got transit systems that border multiple communities. And that's really linked in with our partnerships. So we connect with 59 local government partners. We've got 18 private management companies, 5 public organizations, and 14 nonprofits that directly help us with our on-the-ground operations. And over the next couple of slides, I'll just talk about kind of who does what in this tripartite agreement that we have. Next slide. So I mentioned the BC Transit Partnership Model. It's been called quite a few other things over my time in public transportation. But again, it's a really unique model where that we have the provincial government, BC Transit, local governments, and our operating companies providing kind of different pieces to the pie in order to get transit to work in all the communities across BC. So fundamentally, what BC Transit is, again, we're a crown corporation. The province sets, provincial policy objectives and allocates provincial funding to BC Transit. We then use that funding to plan, transit systems and to make, kind of advice to our local government partners about how to best operate transit within that specific system. We go out and we provide kind of consolidated management functions for a variety of different areas. So we've got consolidated procurement, marketing, we manage capital and finance. We provide other professional services, such as government relations managers and my other colleagues here. So we try to provide really top tier advice and operational oversight to a transit system, as well as bringing forward and being the conduit for provincial policy and provincial funding. As a quick reminder, the province funds about 50% of conventional transit. As a second tier reminder, conventional transit is our fixed route system, so the routes you see around town, stopping at various stops. The province also provides a slightly more generous operating subsidy at 66% for custom transit or handy dart. So those are our door-to-door. That's our door-to-door service for folks who are unable to access our conventional service. So that's what BC Transit is. At its core, we're trying to provide good advice and high-level service to local governments to allow them to operate a transit system. Next slide, please. And then the local government. So the province and by proxy BC Transit are important funders. We fund about half of the system, but so does the local government. So local governments set their preferred funding amounts. They are the final decision makers on routes and service levels. So, where the buses go, BC Transit, we have lots of opinions and lots of expertise, but at the end of the day, it is up to our local government partners, councils and boards to make the final decision on exactly where those buses are running. Local governments also set the fares. So any discussion about fares is entirely the purview of our local government partners, because in our model, all fare revenue accrues to the local government in order to offset their half of the costs. We work really closely with local partners in order to kind of set broad policy direction, what they're trying to accomplish with their transit system. They can range anywhere from frequency to coverage, frequency being we just want to run a really efficient system up and down the spine of our network, versus coverage being we want to be able to have an inclusive system that reaches out to the kind of far ends of our transit service areas. And there's always trade-offs. Provincial funding and local funding is not infinite, and the resources that BC Transit has to deliver transit service is not infinite as well. So we're trying to make really good decisions that meet the needs of everybody, but with the caveat that we need to be strong stewards of public funds. Next slide, please. And then we also have an operating company. They're kind of the unseen or hidden kind of component of BC Transit, but we contract out transit service. So the hiring, the day-to-day operations and HR for the drivers and et cetera to various operating companies around the province. Some of those are nonprofit, some of them are for-profit. Some of them are actually municipalities who run the transit service, but those are the folks who really make a big difference kind of in the day-to-day operations of the system. They're the handy dart drivers who, are helping people in and out of their homes. They're the bus drivers who are helping people, throughout the course of their day. They're keeping us safe. It's an amazing, amazing kind of system that does work really well. So next time you hop on the bus, you may notice, you've got a BC Transit badge on the driver, but there may be a secondary badge that says what company they actually work for and who they work with. But the 3 or 4 partners, when you include the province also, it's a really strong model that I think provides that additional kind of coverage and additional opportunities that you may not see in other regions. And so the point of front loading a conversation about this with some, governance and kind of technical who does what, is just because, things that in a lot of cases seem really simple can be a little bit more complicated under the partnership model, but the partnership model does make for a bit more robust decision-making, and it does provide us with some opportunities to be innovative in ways that we may not see otherwise. And I think that Adam and Afzal are going to talk about, initiatives that BC Transit is undertaking, how interested our local governments are in the areas that we're talking about today. And I think that, a lot of this will bear some great fruit for future conversation. So hopefully I've set the stage adequately, and I'm happy to pass the mic
Over
over.
to me. Awesome. Thank you, Bart, and
Thanks,
thank
Ed.
you for, as you say, setting that stage. I think anytime we talk about BC Transit and whether it's accessibility in transit services, whether it's seniors in transit or just transit in general, I think setting a context for how the world works kind of in the BC Transit umbrella is really important. So the first thing that I wanted to talk about today is really to get at the heart of why we're here. So we're here to really speak about accessibility in transit and seniors in transit. And so this slide really sums up why seniors matter in transit planning. So, you know, I think these 3 points are really, really key. And so the first one to think about is, and as many of you know on this call through work with the provincial working group and other areas, by 2035, 1 in 4 British Columbians will be seniors, and many will rely on public transit. So I think one of the things to really key in on there, and as an added layer that you don't see on that slide, is that in those 1 in 4 individuals that are going to be considered seniors by 2035, if we roll that back, right now, 20.5% of people over the age of 65 identify as having a disability. Sorry, let me actually rephrase that. Between the ages of 15 and 64, 20.5% identify as having some form of disability or impairment that impacts their mobility. When you look at individuals over the age of 65, that number jumps to 41%. And so when you think of it from a transit planning perspective, this is a huge imperative for us and a huge moment for us to be able to try and anticipate the needs of those individuals and make the service as accessible as possible. As you would have heard in the intros for Bart, Afzal, and myself, I have a physical disability that requires me to use a wheelchair to get around. I am lucky that I'm able to get up and ambulate a little bit, but I do have that barrier to my mobility. And so this second one, designing with dignity, is really important to me. And so seniors and those that have mobility challenges, regardless of age, face unique physical, cognitive, and emotional mobility barriers. And the reality is that while we have our HandyDart service, and we'll talk about that in a moment between Afzal and myself, it's not the default answer, nor should it be. The what we call our fixed, you'll hear us use this interchangeably, our fixed use or our conventional service needs to be the first area of opportunity for individuals looking to access services. And so how we design that service is really important. And it's also a strategic opportunity when we look at it from a sustainability perspective, when we look at it from a business perspective. Investing in senior-friendly transit now will deliver long-term community economic and mode shift benefits. And so what do we mean by that when we say that? The reality is that there is so much research out there about the impacts of safe and accessible transit to communities and the lifeline that transit plays in communities. And so when you think about the demographics that we've highlighted here, and also I'll get you to pop over to the next slide as I talk about this, really the ability to invest in the service just makes sense. And so here's that graph and some of those numbers just to provide a little bit of a wow factor about what's coming in this demographic. So you see in 2015, you see the jump to 2025, and then the projections for 2035 and beyond to 2045. So what are some of the implications of that? So seniors and other individuals with mobility challenges contribute significantly through volunteering, mentorship, and economic activities, whether that is through paid work or spending their hard-earned money in the communities that they live in. And so that creates challenges if they don't have their personal mobility, whether it's through a vehicle or otherwise, and you then need to begin to rely on transit if you don't already. If the service isn't built in an accessible and equitable way, those activities will be curtailed. Not to mention the impact on mental and physical health once somebody starts to begin becoming isolated because they're not able to get out in their community. So accessible transit, regardless of the service, regardless of whether it's HandyDART or our conventional fixed route service, is crucial for social inclusion, not to mention things like healthcare access, aging in place, and things like that. So Afzal, if we could pop over to the next slide, that would be wonderful. So that sounds great, but what does the research show? Based on the research that our planning team has done, our government relations team has done, and then through partnerships such as the United Way. And so I think this is a really interesting graphic when you start to look at some of the high level quote unquote personas and some of the changes that you see there. And so what are some of the key challenges to these different groups? And when we were putting this slide together, I smiled because, again, for somebody such as myself, I look at some of these challenges and I go, yeah, a lot of these seem familiar. And that's really exciting to me because that's where we get into this concept of universal design, right? Around how we aspire to design our services to be as accessible as possible for everybody. So some of those key challenges. So there are the kind of the obvious physical challenges. So mobility limitations. There are also sensory challenges. So where we go, hearing and vision loss. There can be cognitive challenges as well for any of you who care for or deal with individuals, clients, or family members with things like dementia and other cognitive barriers. There can be difficulties with complex transit systems and schedules. And then here's another one that we're starting to see a lot more of as our understanding of disability in particular begins to expand. We see also a lot of emotional challenges and emotional barriers, things like anxiety related to transfers and unfamiliar technologies. And that anxiety isn't necessarily because you have a diagnosed anxiety disorder. It can also be anxiety related to safety at exchanges, safety on buses, those sorts of things that I think can be natural for anybody, regardless of where they are or what stage of life they are in. So what does that mean from a design implications perspective for transit, and what are some of the things that we as an organization try to work with our partners on, and in particular our local governments who really are responsible, as Bart said, for setting the service levels and things like that within their transit systems. So some of the simpler ones, because they've been around for a while, are the low floor buses, the inclusion of ramps, and then audible, and some of the newer ones, or the newer design implications that we've tackled here at BC Transit over the last number of years since I've been with BC Transit for the last 5 years, are some audible and visual signage, or signals and signage that you'll see on our buses. So if you ever talk to somebody at BC Transit, or even TransLink, which is, as Bart talked about, BC Transit has responsibility for everything outside of Metro Vancouver. Metro Vancouver is serviced by TransLink. If you have the opportunity to corner any of us and ask us about the things that get us really excited, one of the big ones is really that investment in some of those audible and visual signals. You'll hear us refer to that as NextRide. And that really is the combination of the audible announcement at stops and then the visual cues, or the visual representations of the stops on the buses. Like any program and any new technology, it is not perfect, but it is miles and miles ahead of where we've been in the past. And so I think some of the other things to consider, or that we consider from a design implication perspective, as we introduce technology, and I'll speak to this in a moment on the HandyDART side in particular, is as we introduce apps and other technologies to ensure that they have intuitive, senior-friendly and accessible UX and design. And so in some of the major projects that I'm leading around introduction of technology across our variety of services, accessibility is paramount and first and foremost, and baked into the requirements of these technologies to ensure that as technology becomes the expectation, in particular for this upcoming demographic of seniors, that they're designed in a way that are intuitive and easy to use. And then finally, I think the other important thing to think about as well is the welcoming operator culture and the training that the operators, the boots on the ground staff, receive. And so that is something that, as Bart talks about, that tri-party model between our local governments, BC Transit, and then our operating partners, that's something that our operating partners really focus on in terms of delivering service in a way that is welcoming and safe. And again, like anything in this world, there are exceptions to that rule, and there are people that don't do that well. And our operating partners work as quickly as possible to put remedial actions in place and ensure that everybody has the training, the temperament, and the perspective that they require to deliver this service. I think the other thing to bear in mind, and this is where we'll start to blend in the HandyDART piece into the services. So HandyDART is our door-to-door shared ride service for those individuals who have a permanent or temporary disability that is significant enough that they're not able to safely and efficiently use the conventional fixed route service on their own. And that definition comes right out of the BC Transit Act and is the program that AFSL and I oversee in particular. And when we work with the Office of the Seniors Advocate, which we have a wonderful relationship with, I think one of the really interesting statistics that comes out of that is 26% of HandyDART users across the BC Transit system utilize the regular fixed route service as well as HandyDART service. And I think when you think about that and you think about that definition, and then you try and marry that with that 26%, I think one of the key things to remember is that we at BC Transit can make the bus the most accessible place on the planet, but if the infrastructure around that bus and to access that bus isn't accessible, that also creates challenges. But it is important to note that of our HandyDART users, there are a subset that use the conventional fixed route service. I am one of them. And really that comes down to accessible design and then training opportunities to get people comfortable with the fixed route service, which AFSL will speak to in a little bit. So again, I think this key challenges slide, I've summarized a lot of that previously, but we want to point these out because this is based on the research that we've conducted with a number of our partners and some of the key things that we consider when it goes into design, when we look at designing our services. So with that in mind, I'm going to pass it over to AFSL for the next couple of slides, just to speak about the different transit services that we offer under the BC Transit umbrella, how they kind of intersect with accessibility. He'll chat about that, and then we'll dive into a conversation around HandyDART between the two of us.
All right, thanks, Adam. On this slide, we see the transit services that BC Transit offers. First and foremost, you obviously have the conventional transit, or as you may know it as the city service, the city buses. These have fixed routes and fixed schedules, and they are mostly present in urban settings. And basically, these are the regular buses that you see. And then we have the custom transit, which is what we know as HandyDART. These are, as mentioned a few times, these are door-to-door service, demand responsive, which basically means that it has to be demanded for the service to be delivered. And it is for people who cannot access the conventional safely and independently. And it's linked to taxi programs such as the taxi supplement. That is when instead of sending you a HandyDART bus, we'll send you a taxi for either because there's no bus available or it's just operationally more efficient to use a taxi instead. And then we have the paratransit and on demand, which is basically which has a flexible routing and schedules. And basically what it means is it generally have a fixed route, but then the community that is existing is often small enough that you can just call into the BC Transit office and ask for a pickup at your house. And obviously this happens on the smaller buses, which is kind of akin to the bus sizes that we use at HandyDART. And it's normally in small communities and rural and small communities where generally people know each other by a first name basis. And then we have the Health Connections. And this is basically a paratransit service that is funded by the Health Authority. And it provides access to medical appointments to small communities, small and rural communities. Basically what it does is in smaller communities where they do not have access to higher level of healthcare, the bus will meet them up at a certain location in that small community and bring them towards the regional healthcare center. And we've talked about HandyDART before, and the definition of HandyDART as per the BC Transit regulation, which we are bound by, is that HandyDART is an accessible door-to-door service, customized and shared transit service, and it's provided to clients who cannot safely and independently navigate the city buses without assistance. And for your reference, we have 251 dedicated buses, i.e. HandyDART buses, across 29 communities, serving almost 18,000 active clients. And for your reference, active clients are what we define as a HandyDART client who has used the HandyDART service at least once in the previous 18 months. And now we talk about, is HandyDART a solution? And this is where we compare our city bus service versus HandyDART. Obviously, the conventional service has the fixed route, it has a fixed schedule, it serves the general population. It costs BC Transit $4 to $7 per ride to deliver that service. And so and you know that you're paying between $2 to $3 for the bus tickets. So essentially this means there's a subsidy of $2 to $5 depending on the city that you live in. And we've delivered like 55 million rides across the province last year. And the perks of the conventional is that you don't need to book any rides and it's just walk-on access. And for our city buses are mostly accessible, fully accessible. And now when we look at the HandyDART has to be booked ahead of time, even though it is a door-to-door service and it assists people with various disability and mobility challenges. But in order to deliver that level of service, it costs BC Transit $40 to $75 per ride, which essentially means the local governments and the provincial government is subsidizing $35 to $70 per person. And we delivered 750,000 rides roughly in the previous year. So with, as we've mentioned, the number of seniors are expected to increase in the coming years. At the same time, we are aware that the government is putting more scrutiny on government expenses. So with all that in mind, it begs the question, is HandyDART the solution? And with that, I believe it's over to you, Adam.
It is, yeah. And so to build off, is HandyDART the solution? And so I can see a number of questions that have gone into the chat, and I think my ask would be if we can drop them into the Q&A, because I think there are some really good ones that I want to address there, and hopefully what I can do is through what I'm about to share with you next, I can talk a little bit about some of the questions that are there. And Afzal, could I actually get you to back up to the previous slide, because I think that's a really good one just to have up to talk about it. So, is HandyDart the solution? My answer to that would be HandyDart is part of the answer. It is not the only answer. This is where we talk about that consistent and universal system design that is really important. Because the reality is, and as you can see on this slide here, HandyDart is it is more restrictive just due to the realities of how the service is required to be operated than our fixed route conventional service. Our fixed route conventional service, you have anchored pickup and drop off points based on stops. You have the schedule where you know what the frequency is going to be, those sorts of things. So if you have the ability to use the fixed route service, it does allow you a higher level of spontaneity and flexibility than the HandyDart service does. And so let's dive into why that is and what we're doing to also address some of the challenges that we know exist in the HandyDart system. So Afzal, you can pop over to Maya's HandyDart, the solution slide. So if you back up one, there you go. And so the HandyDart service is demand-based. And so what does that mean? That means that, as you all know, you have to call in to pre-book your rides. And the question we often get is, why do you have to do that? And there's a couple of things at play as to why that is. HandyDart service isn't just about matching the individual to a bus and generating a ride. There's a couple of things at play. So obviously it is a shared ride service, which means if myself, if Afzal, if Beverly, and if Bart, if we all call in for rides at relatively the same time, and there are 2 buses available, then the schedulers and dispatchers need to basically play this massive game of Jenga to figure out pickup points or pickup times to get each and every person to the place that they are trying to go on time or within a reasonable window. That's relatively simple. Where the challenge then comes into the HandyDart equation is the fact that it's not just the person in the ride, it's also the barrier or the challenge that they may have in accessing services. So those really classic definitions of disability, myself being able to articulate my needs, but being in a wheelchair, and potentially somebody such as Afzal, who, let's say Afzal has a cognitive disability such as dementia, but he's able to board a bus himself, those sorts of things. We're the 2 easy people to essentially schedule and dispatch HandyDart services for. But I'm going to pick on Bart. I always pick on a BC Transit colleague when I use this analogy. But let's say Bart is also requesting a HandyDart ride at the same time. And Bart, for all intents and purposes, looks able-bodied. It doesn't look like he has any barrier. But let's say, and I'm using very generalized terms here, and I want to be cognizant of our time at 11:45. Let's say Bart's barrier is such that if he is on a bus for longer than 25 minutes, he starts to have some situational challenges where he may become agitated or violent. Or I'll use a real world example. Let's say Bart has a disability or a barrier in which he is okay to ride the bus unless he's with somebody on the bus like Afzal, who, let's say, is in his mid-30s, and then at that point he becomes aggressive or starts to have some other challenges. That's really where the jigsaw puzzle comes in around the HandyDart service, and can also create some inefficiencies. And so what are we doing about that? I am in the midst of working on a quite a large project, and I can see a thing that just went into the chat about AI for scheduling or dispatching. And what I can say at this point is I am in the process of working on a large project to modernize the scheduling and dispatching, as well as introduce self-service options and modern ability for individuals to book and manage their trips. We are in the procurement phase of that. We're coming down to contract negotiations, and really one of the major things we see this addressing is that those efficiency challenges that we know we have. What that will do is that will lower the cost per ride that you saw on Afsal's earlier slide, as well as put some control back into the client's hands or their caregiver's hands in terms of the ability to book and manage trips, as well as increase notifications and so on and so forth. So there is better communication. So I did see a lot of questions around those sorts of things. And I just want you to know that they are concerns and challenges that we share with you as well. But when you think about being in multiple communities across the province, there are 29 communities that we deliver HandyDART services in, all with unique challenges. So we need to build a system that works for all the different people that access our services. And it is very challenging because there is also only so much we can do. I saw, somebody else put that in the chat as well. And then the last thing that I'll just address before I dovetail over to Afsal to talk about our travel training program, which is something that we're really proud of and we want to continue to build out, is the taxi usage and people going, why is that used? So really, again, under the umbrella of the fact that HandyDART is a public transportation service, our goal is to try and deliver as many rides to as many people as possible. And we don't have the ability to prioritize one individual's reason for utilizing HandyDART over another, because that would go against the public transportation model. So there are times where our operating partners partner with taxi companies to essentially act as an overflow. And so as Afsal said, taxis are utilized and dispatched in lieu of a bus for two reasons. One, if there is so much demand for the service that a bus is not available, but if Afsal is an ambulatory client who has the ability to utilize a taxi, then that is there is an ability there for Afsal to still get a ride. Otherwise, that wouldn't occur. And it also is used to reach clients that may be at the farther end of a service area, to still allow them to utilize the service while allowing a bus to be dispatched more effectively and efficiently to offer additional rides. And so I know we're bumping up against time here. We said our presentation would be 20 to 30 minutes. So I want to make sure whether we add time for Q&A or we get to it in the next couple of minutes, I do want to pass it over to Afsal to speak about our travel training program, which is really something designed to get those people that are 60 to 70% comfortable with the fixed route service, the training and the education and the skills they need to be able to maintain their flexibility and use fixed route as opposed to HandyDART. So over to you, Afsal. You're muted.
Thanks, Adam.
That was bound to happen once.
Thanks, Adam. So travel training. BC Transit provides a travel training program in Victoria, Kelowna, and Kamloops. And our operating partners, the contractors who deliver the service, they have their own travel training programs in Chilliwack, Central Fraser Valley, and Fort St. John's. And the purpose of this travel training is to provide education on the features, the accessibility features, and what are the facilities that are available to the clients on the conventional, which are the city buses, as well as the HandyDART buses. And these travel training can be either individual or towards a group. And the client can determine at the end of the day what's the most appropriate service that meets their needs. And during the process, we'll also be sharing about the registration process to access HandyDART. And ultimately the program is to move some of the clients who would have otherwise been HandyDART clients and just give them that boost of confidence that needed just to help them build up that confidence to use the city buses. And with that,
Thanks, Hav.
to you, Adam.
Passing it over to me. And so, yeah, the travel training, to sum travel training up, it really is that, obviously, that one-on-one or that group service to get somebody comfortably using the fixed route service, whether they have a mobility aid, a newly acquired disability, whatever it may be, in order to allow them to maintain as much flexibility as possible. And so, again, to summarize, what are some of the things that we're doing to try and build our service to be a senior's best transportation solution? And so you can see that safe and accessible travel. So operator training on assisting seniors, transit information lines and updated user guides. We talked about the accessible infrastructure and tools, which we know is an area that can always use improvement, and is something that we continue to partner with our local governments on. Then there are some programs that we talked about, so travel training, and that one really is one that I can't emphasize enough, because again, it is designed to get you as a potential transit user as comfortable as possible using the fixed route conventional service, to allow you that level of spontaneity and flexibility that at the current time doesn't exist in our HandyDART service. So then the second piece is that HandyDART modernization. And so I did see, some questions about specific regions of HandyDART service. So Kootenay being in the example, and that's really where this HandyDART modernization comes into play, in building a system that allows the service to be more transparent, effective, and efficient. And then there are targeted fare programs related to seniors in terms of their bus passes and accesses to services as well. And we have a team that constantly looks to engage with the community around those services and whether they're working. And then the other big piece really is the ongoing engagement, whether through services or forums like this, as well as consultations with advisory groups that we do on an almost constant basis, and then feedback loops that we have built in through surveys that go out on a monthly, quarterly, and annually basis, as well as feedback that we get from frontline staff. And so one of the piece that I'll end on there is I just want to encourage people as much as they can to engage with frontline staff as you're comfortable with technology, engage with our website and use the Contact Us forum to be able to leave a compliment, a concern, those sorts of things, because there is a human being that looks at every one of those complaints. When somebody calls in to BC Transit and lodges a complaint or concern or a compliment, they go to a team of humans that are review them and follow up as necessary. So we really do value that feedback as well. We're at 11:55, and I can see some Q&A popping into the chat here. And so I want to thank you for your time and for hearing us out and listening to what we have to say. These are engagements that we love to have. And so really, I'll open up the floor to some of the Q&A. Bart, I know there was one question that it looked like you were wanting to address. I'm not sure if you did that in the chat. Otherwise, I can field some of the HandyDART related questions that are in the Q&A.
Yeah, I've been pecking away at some of them in the chat. I will admit I don't know where it goes after I type it in. So hopefully everyone has access to it. I'm more than happy to stay late, and I apologize for going over time, and answer questions. It seems like good company for lunch, but I don't want to commit everybody else.
Yeah, I'm happy to stay as well.
Thank you, Bart, Adam, and Avsal. The 4 minutes now remaining. And even if we do stay a little late, I think we'll leave the many folks from the community-based senior service sector who are telling us thank you now and are going back to, are going off to lunch. I'm wondering whether we could interest you three good people in a follow-up session. The material that you've presented is just so interesting, and it seems to me we would do a real disservice to the work you've put into this and what the topic itself offers in terms of exploration and mutual problem solving and specific feedback to people with big questions,
Mhm.
whether they're in Tofino or Slocan Valley or Main Island, because this, of course, is focused on the rural, the small town services that you provide.
I think we're always open to having conversations. Is kind of the way I would put it. Bart, is there anything else you want to add there?
No, that's perfect. Yeah, I'd be happy to do it anytime.
Yeah.
And
Also,
I will peck away at the questions that are my responsibility in the Q&A until they taper off today.
Laura?
Oh, I was just going to add in, and we are able to download the comments in the chat and also the questions in the Q&A, so we can pass them on to you three.
Sure.
So you can look at them and see if there's any additional follow-up information that you want to provide to the webinar attendees, because normally we send a follow-up email. So that's one way that you can respond to the questions, and then we can make sure everyone's comments and ideas are reviewed. And the one other thing that I think we can do in the follow-up email is I gather that a lot of the questions and comments are about interest in connecting with BC Transit and getting your services to their communities. So maybe we could also include in that follow-up email just a little bit of information about how people might go about doing that if they're
Sure.
interested.
If you'd like to synthesize, a lot of those down for us, I think then between Bart Afzal and myself, we can either respond to the questions or gather information from our different teammates across the organization to best answer them. Bart and I are probably best positioned to talk about the service expansion piece, and so I'll just say this very quickly, and then if Bart wants to add something, he can. If individuals are interested in and desire service in their communities, that's really where the partnership with the local governments comes into play. Is start to have conversations with your local governments, because it is really, as Bart mentioned earlier, they are the ones that drive service levels, service areas, those sorts of things. And if they come to us with interest in service, then we will actually work with them to explore what that would look like. Bart, again, anything else you want to add in there? Because I know that's kind of the two areas that you and I both kind of live.
Nope, I think you've nailed it.
Yeah. Awesome.
Okay, well, I think we will be able to respect the 12 noon wind down closure. And I would like very much to thank you all from BC Transit and thank our audience for tuning in. I would invite you all to stay tuned to see what United Way BC's conversation with BC Transit yields in terms of next steps. I feel like we've just identified a really rich vein of information and progress and development, and passion even from BC Transit, and I don't want to drop it. Personally, I don't want to drop it. So, but of course, I'm not the only one involved, and we'll be giving you an update. You'll see it through the United Way BC Healthy Aging e-newsletter. You'll also get a direct email from us as a result of registering. And please keep thinking about BC Transit services in underserved areas of the province, mostly the rural, small town, remote areas. Again, a huge thank you to Bart, to Adam, to Afzal. This has been really good. It's exactly what we were hoping to get from you. Thank you.
Awesome.
Very
Wonderful.
much.
Thanks, everyone.
Okay.